Hi friends, today sharing a very interesting case of peritoneal mesothelioma. The history is the 39 years lady with a history of primary infertility of 9 years, no history of fever, weight loss, abdominal pain, prior history of metroplasty, and an ovarian cystectomy for endometriotic cyst was present in this lady. She was referred for a routine infertility scan. And what we see on a transvaginal scan, the longitudinal and the transverse section, showing us a multicystic mass which was composed of cluster of small cysts seen filling the entire POD and surrounding the uterus and the ovaries, which was measuring approximately 10 into 8 centimeters, and no surrounding ascites was seen. Then looking at the still images, we do see the right ovary was normal and there was a endometrioma which had reoccurred in the left ovary. The uterus was normal, and on power Doppler, minimal flow was appreciated in the intervening septa of this particular mass. So finalizing, we had a multicystic peritoneal mesothelioma, and the tumor markers offered were normal, and she underwent a cytoreductive surgery and peritonectomy. They found a yellowish, soft grape-like mass with multiple cysts measuring approximately 10 into 8 centimeters, and the cysts showed a clear fluid. On a histopath, the cysts lined with single layer of flattened to cuboidal mesothelial cells without ATPR were seen. There was no tissue invasion, no mitotic activity. All the tumor cells shows immunoreactivity to calretinin and WTI, thereby giving us a diagnosis of benign multicystic peritoneal mesothelioma, which is, of course, to summarize, is very rare, arising from the mesothelial cells of the peritoneum. Associated risk factors, as were seen in our patient, she had a history of endometriosis. She had a prior abdominal surgery. It can be also associated with pelvic inflammatory disease. These lesions are diagnosed predominantly in the premenopausal women, and a strong predilection for the pelvic area is seen, as happened to be seen in our patient. Malignant transformation is extremely rare. Thank you so much. Please like, share, and subscribe my channel.